Ganoderma, Lingzhi/Rishi for positive cancer treatment Part 2. Why are polysaccharides in Rishi effective in the treatment of cancer? Polysaccharides are made up of a high number of molecular components, up to millions of atoms, and this makes it difficult to be absorbed into the human body system. In order to make it easily assimilated, its high count has to be lowered, and using vitamin C with Rishi does just that. The polysaccharides are converted into oligoglycan that has a low molecular count and can be easily absorbed. It in turn stimulates the macrophage, which triggers the immune system in our body. Macre meaning big. This type of cell can devour any foreign organisms. They are not active when the body is functioning normally, but, in the presence of foreign organisms, for example bacteria, they become very active in attacking such bacterial foreign matters. The white blood cells in the bloodstream comprise the initial defense against diseases, but they are ineffective in chronic cases or malignant type of matters, at which time the lymphocyte becomes the second line of defense. Failing that, the last defense will be the macrophage. It is like a sleeping lion being awakened to attack with truly exceptional result. They are capable of sweeping away any foreign organisms, thus destroying the cancerous cells in the process. Under the microscope, the macrophage is observed to be 1/10 the size of a cancer cell, yet, it possesses the power to destroy the latter. From this, we can understand their invaluability to the human body. However, the macrophage cannot be easily activated. We have found that aggregated atoms are responsible for this activation of the macrophage, and Rishi contains the substance to manufacture these aggregated atoms. Rishi, a high molecular polysaccharides. Earlier, a patient with high blood pressure had inquired into the effects of Rishi. I had told him that there was certainly no harm in trying, as I had conducted research at that time. One fact is, even a diluted dose of Rishi essence lowers blood pressure. However, this patient had maintained his blood pressure level after Rishi ingestion. Following my suggestion to ingest vitamin C together with Rishi, his blood pressure dropped to an acceptable level. The reason for this is, as mentioned previously, Rishi contains up to 1 million atoms and cannot be easily absorbed into the body, therefore, one should combine it with vitamin C. 17 years ago, I have conducted research into the vitamin C's ability to break down polysaccharides. At that time, the method of viscosity gauge has been employed. Placing vitamin C into a measure of polysaccharide substance, a decrease of the polysaccharide's molecular count is indicated by a drop in the viscosity. Thus, confirming vitamin C's ability of dissolving polysaccharides. Animal experiments have shown that all forms of sugar can be absorbed but are just the opposite in human. Why? This has some correlation with vitamin C. Human body is unable to manufacture vitamin C, while animals can. This is the reason why we need to combine the intake of vitamin C with Rishi. New medical findings indicate that there is no harm in taking high dosage of vitamin C daily. Dr. Linus Pauling, who is now in his 80s, ingests 18 grams of vitamin C daily, and I ingest 12 grams a day. I believe a healthy person needs a supplement of 1 gram to 2 grams a day, that is 1,000 to 2,000 milligrams. Brain tumor patient recovering consciousness in just 2 months. We have made many discoveries. Using brain disease patients as examples, one 70 years old plus patient in the hospital had a 5 cm brain tumor. He had already lost consciousness despite surgery. He began the Rishi treatment around June of 1986 and by September, he had recovered his senses, but the size of the tumor had remained the same. However, by December, the tumor had decreased in size. Even the neurologist was amazed. The patient now feels very well. Initially he was administered 6 grams of REISHI'S through a stomach tube. After the recovery of his senses, oral intake was administered. The patient did not like the bitter taste of REISHI'S, so the amount was reduced to 3 grams. Although the dosage had been reduced, his brain tumor eventually shrunk to about 1 centimeter. With the return of his memory, he left the hospital and stayed home with the family instead. Recession of lung cancer within 6 months. I once treated a 50-plus female patient who had breast cancer. After her breast surgery, she had developed metastatic lung cancer. Later she deteriorated to hemoptysis. She began to use about 6 grams of reishi daily for 6 months and the cancerous lung tumor disappeared. Before, she is often short of breath, but now she can walk up the stairs effortlessly. Therefore, she has complete confidence in the continuation of the reishi treatment. Breast cancer cured in 2 months with mega dosage. This patient had breast cancer and the cancer cells had metastases to the bones. She had not been able to move from the head down. The pain was excruciating. Luckily, her digestive system was not affected and she was able to take 9 grams of REISHI'S daily, which was later increased to 20 grams. In just 2 months, she felt no pain. She had been discharged from the hospital after she made progress in her walking ability. Cancer of rectum spreading to the liver with remarkable recovery in 6 months. Some time ago, this patient came to the hospital for treatment of metastasis of rectal cancer to the liver. He was given 6 grams of REISHI'S. In 6 months, CT scanning reported that the cancerous tumor had decreased to about 1 centimeter in size, but the CT specialists did not believe in the merits of reishi and insisted that there was a mistake in the scanning. I was angered by this and argued that not only had the patient's CEA swelling came down but his general health had also improved. Was it not enough proof? Ordinarily, it is difficult to treat rectal cancers. Some cases are even terminal. This patient had such a smooth recovery which could only be credited to reishi. Generally speaking, it is easier to treat rectal tumor under 3 centimeters in size. Pancreas cancer patient can walk again. A 60-year-old male pancreas cancer patient had surgery and was in a better state for a while, but later deteriorated. He had edema and lost weight. Examination results revealed that he had extremely high count of CA19-9 CEA. I informed him that with his present treatment he would die within a short period of time. I advised him to be hospitalized. Due to financial reasons, he was given another kind of medication, but he reacted unfavorably to it. Therefore, we had to change his treatment to 9 grams of reishi essence orally and 30 grams of vitamin C through intravenous injection daily. This began from August of 1986, which was over 1 year ago. The patient had since completely recovered and various examinations could not detect symptoms of any kind. He has gone back to work but continues to take 5 grams of reishi daily. He comes for a follow-up examination every 2 weeks and repeat CEA examinations show that his CA19-19 counts continues to drop. There is many more such cancer cases in my hospital. Although cancer cases involving the brain, lungs and liver are more serious, I feel that it is easier to treat than the cases involving the digestive organs. It is harder for the patients of the latter to ingest reishi orally. Besides cancer, reishi is also very effective in the treatment of hepatitis. With the use of 1 gram to 3 grams of reishi essence daily, hepatitis patients will have tremendous recovery results. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.